Hi, welcome to Schein Chats. Today we'll delve into the critical intersection of oral health and overall health, with a particular focus on the invaluable role that public health plays in serving underserved and underrepresented populations. I'd love to start with this question. How can we shift the paradigm from oral health as a separate entity to fully integrating it into a comprehensive healthcare model?
Hi, Kathleen. Thank you. And that's a great question. We traditionally think of oral health being separate from overall health, but really think changing the framework of thinking of the mouth being part of the body, we can change the conversation from separating oral health from overall health and talk about overall health and oral health being part of that. And one way I think that can be accomplished is to start thinking about how do we better integrate oral health services within medical services. And it could be within the healthcare settings. It could be with the relationships that perhaps maybe in a rural community, the dentist has with the primary care provider. So there's ways that it can be addressed. Part of it is also through the education process, the learning process, and not for dentists to only learn about the medical side and overall health, but for the physicians, the nurses, individuals in medicine, learning about how oral health is an important part of a person's overall health.
Absolutely. Good answer. And I think we're seeing a lot more collaboration now than we ever have in the dental space and medical.
Yes,
So,
for
Dr.
sure.
Kim, can you tell us about the American Association of Public Health Dentistry and your role within the organization? And going forward, I'll affectionately be calling American Association of Public Health Dentistry the acronym AAPHD.
Yes.
Okay with you?
I'm fine with that. It is a
Okay.
mouthful for sure. So AAPHD is an organization, an association with members. And I see two things. One thing we do is we want to provide leadership to ensure optimal oral health for individuals and communities. We also support the specialty of dental public health. Some may not be aware that dental public health is actually one of the 12 specialties within the in dentistry within the ADA, and we have members who are board certified and specialists in the area of dental public health, and so we support them in that way as well, and students who are training.
And I think this question is related, but could you elaborate on the role of dental public health in helping bridge that gap between oral health and overall health, especially with those underserved populations?
Sure, that's a great question too, Kathleen. I think one thing that probably comes to mind for most, or first, I should say, is delivering oral health services, delivering care to underserved populations. So that's one part. But when you talk about dental public health, it involves more. So one part is looking at doing some research, and it could be community-based research, be epidemiologic studies, and we're going to use that to develop programs that can be implemented within communities. And it can be as small as within one town, it could be in a county, the state, or the entire country. So that's part of it. And also the information that's collected can be used to help inform policy and decision making. And then also think about how are we practicing public health within the community when it comes to oral health.
As a membership organization, how does AAPHD plan to attract and engage young professionals in the field of encouraging them to become the change makers for our future and in the realm of public health dentistry especially?
Yes, that's great. Young professionals are so important to our organization, as well as I would say to any organization. And we have to engage them. And there are different ways that we've been working towards engagement. One is to get them involved in the organization, find something they're passionate about, and have them have a voice in within the organization. We encourage students of regardless if they're college students, dental hygiene students, nursing students, whatever student, residents, other dental residents to join, because we want to have those different perspectives. And I think it's also very important to allow them a space to share their work, present at meetings or in other forums. I think that's so important to engage young professionals.
Well, nice that you're walking the walk and talking the talk, because you have one of the most robust poster presentations that I've ever seen at a
Thank you very much.
Very, very meaningful to see those young people really put all their self into it and come out with these presentations that help everyone else learn from them.
Yeah. Oh, thank you. Thank you.
Take it from somebody that visits health centers and engages with health centers on a regular basis. What we're seeing is now coordinators that are hired and committed to working across the aisle with medical and dental in the health center setting. And it's really encouraging to see that there are health centers that are taking the lead in making sure that there's no wrong door. So if whatever door you walk in, whether it's dental or medical, you get the point of care testing that's so important to gauging someone's health when they walk through your doors.
For sure, for sure.
So can you discuss the importance of building partnerships with organizations and working in the public healthcare space? How can these collaborative efforts enhance the impact of AAPHD's mission and the mission of public health as a whole?
You know, what you had just mentioned about a person coming into a community health center and walk whichever door they go into first, oral health, the dental clinic, or into primary care, and they're going to get those services regardless. It doesn't matter which door you come in first. I think that is, it happens because there's collaboration and partnership within that organization. That's really important. I think having also collaboration, partnerships with associations, organizations outside of dentistry. So engaging the medical folks, primary care, family medicine, OBGYN are important in kind of maintaining this and sustaining programs around integrating oral health and overall health. I think as for AAPHD, we have members who are physicians who work tirelessly in engaging not only their own communities, but like outside communities to consider and think about how to bring in oral health within the practice. And I'm not just talking about within pediatric medicine, because I think that's kind of a more natural thought, but in family medicine as well.
And measuring and manage those outcomes, because what we all want to see are healthier patients, right?
Absolutely. I know. I mean, it'd be great. We all, want to live a well-lived life, a healthy life.
Yes, absolutely. Well, my observation is that the providers that work in the public health space, they're something special. They are servants, they're committed and relentless. And I've always been so impressed with that group of providers. It's just really heartening to see that.
It really is. I am too. It's amazing. They're amazing.
Well, it was great chatting with you, Dr. Kim. We are excited to continuing to partner towards the advancement of oral health within the framework of community health, and we so appreciate your expertise and your many, many years of service in the public health arena. Thank you so much.
Thank you, Kathleen, and we look forward to continuing working with Henry Schein Cares. They do a lot around with a lot of things around the country, so really appreciate your support as well.